Welcome. I'm Dr. Michelle Rathel, Chief Medical Officer of Revolutions Naturopathic. Our infusion center is a prescription-only facility, and orders from your doctor will be followed as prescribed. This video is to familiarize you with the amenities available in our state-of-the-art IV suite. In each station, you'll find a plug for your electronic devices, a red call button, a dimmer, and a light switch. Wireless access is available, and a limited number of tablets are available for patient entertainment. Personal eye covers and headsets are also available and can be stored for you between appointments. A doctor or medical assistant is nearby to get you water or help with making you more comfortable. Please let us know of any special requests, and we'll do our best to accommodate you. The red call button should be used if you need prompt attention. If you're feeling nauseous, lightheaded, woozy, hot, or uncomfortable in any way, please do not hesitate to let us know. Please don't wait to see if the sensation will go away. There's no excuse for you to be uncomfortable, and it's likely that the symptom will just get worse unless we're notified to slow down your drip or add an ingredient to your IV to resolve the symptom. A few pieces of information about your IV. IV therapies can cause aching or discomfort in the administration arm if the drip is too fast. Just let us know and we can slow the drip rate, get you a hot pack, or add a buffering agent to your IV to make you more comfortable. IV therapies contain high levels of nutrients that are being delivered directly into your bloodstream. Your brain will associate these nutrients with the necessity to digest food. If you have an empty stomach, this neurological signal will make you nauseous. For this reason, it's critical to eat a protein-rich meal within 2 hours of coming in for your treatment. We have nuts and other snacks available at our refreshment counter, but it's recommended that you eat before coming in or bring food with you to eat during treatment. Feel free to get water, tea, or snacks at the refreshment counter. Our reverse osmosis spout has an Insta-Hot function. Water from this faucet comes out immediately hot enough to steep tea, so please don't test it with your fingers. Every now and then, you'll notice a tiny bubble in your IV line. This is perfectly harmless. Spy movies that show how to kill someone with an air bubble are based on myths. A bubble's only dangerous if it's greater than 10 cc's or if it's introduced into an artery. We do not use timing pumps, so there's no need for concern if your solution is in the line. It will stop at the level of your heart, and no air will be introduced into your vein. If you notice that you're done before we do, please let a doctor or staff member know, and we'll take care of you as quickly as possible, but there is no cause for alarm. Not all IVs are created equal. Your IVs are individually formulated and put together in our state-of-the-art medical clean bench. This technology provides you with the cutting edge in aseptic technique. Your doctor has created your specific formula from our selection of 39 different vitamins, minerals, antioxidants, chelators, and amino acids, ensuring that your needs are being met by the most thoroughly composed nutrient IVs available. This is why you'll notice that different IVs are different colors. Different offices may also use the same name for something that's formulated differently from office to office. This is why we require a formulation from your prescribing doctor rather than just the name of a treatment. IV administration sets have a reservoir chamber that allows us to monitor the speed of your IV. This is calculated as drops per second. We set a safe administration rate that has a range. We use catheter needles for comfort and mobility. A needle is used to introduce the soft, flexible catheter, which remains in the vein for your IV. Because they're flexible, they may cause your drip to slow down or stop if bent. Please be aware of your position, since the bend of your arm or the rotation of your hand can change your drip rate. Please don't adjust your own drip rate. If a change is needed, let a doctor or staff member know. If you need to go to the bathroom, just have a doctor or medical assistant apply a compression bandage, and you can take your bag with you and hook your bag in the bathroom. Remember to keep your arm straight and the bag higher than your arm so the blood doesn't backflow. If you do notice a bit of blood has backflowed, don't worry, it will flow back in once you've returned the bag to a position that's higher than the level of your heart. On some occasions, clotting may occur, causing the drip to stop, which will require repositioning of the needle in a new location. When the weather's nice, we encourage you to enjoy our peaceful patio and tea garden. Before you get up, have a doctor or medical assistant secure your IV with a wrap to make sure it stays put as you move around. On your way out, be sure to grab a game or book, an IV pole, and a portable call button. If you have children or family that will accompany you, this space allows plenty of room for you to spread out and relax. There are also plugs and wireless access on the patio if you need to get some work done while you're here. We do have video monitoring as an extra safety precaution, so we can see you, and we'll come out to check on you regularly. IVs can take anywhere up to 3 hours, so we encourage you to use your time to get a workout in. Hooks are provided next to the treadmill, and a cardio strap is available for your use as well. This amenity is first come, first serve. If you have a family member or friend with you, we have provided folding chairs in each station for their convenience. Please be respectful of your neighbor's space. You will notice that our IV suite is in a group setting. You are welcome to chat and socialize as you like, and if you're not in the mood to socialize, feel free to drop the curtains and relax. Please be respectful of others' personal space by using headphones to watch movies and keeping your cell phone conversations to a minimum. Your supervising IV doctor and medical assistant make your health privacy a priority. We only use first names and do not share personal information with other patients about you. Our doctors and staff have an obligation to keep your medical information private, so some questions may not be able to be answered in a group setting. If your doctor is not supervising the IV suite, they're likely in other appointments with other patients or are out of the office. So if you have a question about your case, your treatment, have a new symptom, or need to modify your treatment plan, we recommend that you schedule your IV during a shift when your primary doctor is not supervising the IV suite. Your doctor can come and get you during your IV to check on your progress, modify your treatment plan, or answer any questions you may have in a private setting. This way, your doctor is able to focus on you without any distractions and make sure that your needs are thoroughly met. If you just have a quick question, please leave a note with the front desk. We'll get it answered as promptly as possible. If your question requires more information in order to be answered, you'll be asked to schedule a follow-up. This policy is for the safety of others receiving IVs, as well as to ensure you the best care and attention. If you're waiting for labs, you'll be notified of their arrival within 24 hours of our office receiving the results. One of the things that we treat is chemical sensitivity. Some of your fellow patients are here for therapies geared towards detoxification. Please don't wear perfumes, fragrances, or essential oils to the office. These scents can set patients back by months. We really appreciate your consideration on this. You will not be able to change IV formulas last minute. We schedule IVs to start in 15-minute intervals. This allows us time to set your line and make you comfortable before the next person comes in. IV formulas are compounded 1 to 2 hours prior to your arrival to minimize wait times. If you're not coming in or are not sure if the treatment scheduled for you is what you want that day, we need at least 3 hours notification. If you're ill, it's recommended that you cancel chelation or detoxification therapies, and you may request immune boosting or nutritive therapies instead, but only with a minimum of 3 hours warning before your scheduled appointment time. Please note that you will be billed for your IV unless you give us 3 hours notice of cancellation. If your IV has been prepared for you and must be thrown away, it will be added to your account. If you have a port or PICC line, please let us know. Our doctors and staff are trained in sterile technique, and use of these devices will make your treatment more comfortable. We strive to stay abreast of the latest World Health Organization standards and implement updated protocols and techniques as they come available. Please be patient with us if we're more stringent in our procedures than you may have experienced in the past. Our purpose is to give you the best care available. If you have a port, please remember to apply your numbing cream at least 1 hour prior to treatment for best benefit. If you're interested in more information about IV therapies offered, you can find it on our website. Our website also offers a sampling of the most recent peer-reviewed clinical research papers associated with each treatment for your perusal. Extended versions of these articles can be found on PubMed.com. Please be aware that you may experience side effects such as discomfort at the injection site, thrombophlebitis, fatigue, muscle cramps, kidney problems, etc. Your doctor can typically prevent these. Smoking and consumption of alcohol interferes with these treatments. Consumption of minerals and fish high in mercury within 48 hours of chelation may also interfere with the impact of each treatment. If you're here for ultraviolet blood irradiation or biophotonic therapies, please notify your doctor if you begin taking sulfa drugs, tetracyclines, or phenothiazines. There is a rare possibility of photoallergy in the case of allergy to sunlight. Other side effects, although not listed in the literature, may also be possible. In the event of any adverse reaction after treatment, please contact this clinic for further instructions. If it's an emergency, call 911. Most adverse reactions will occur while you're here or within 1 to 2 hours of treatment. Your safety is our priority. Regular follow-ups and lab testing are essential to ensure progress is being made towards your health goals. If you have any questions about this video or the consent forms, please let a staff member or doctor know. Thank you for allowing us to participate in your journey towards better health.